Imagine you enter your car and turn on the radio, but instead of actually hearing the lyrics or the melody that you know, all you're shown is the raw radio signal from the radio tower. And you're asked to predict whether or not this signal is from a Beyonce song or an Eminem song. This would be pretty much impossible to do, as this signal is not interpretable to us. This interpretability gap is similar to the one that surgeons are facing when trying to determine if tumor cells remain within the body after treatment. Let me explain. In patients who receive breast cancer surgery, up to 30% of them actually have tumor cells that remain in their body after treatment. And while doctors attempt to determine if this is the case, this could take days or even weeks to understand due to limitations in hospital resources, leading to the patient having to deal with this disease for a longer period of time and have the associated side effects of this repeat treatment going forward. Luckily though, there's been this novel technology that's been developed, known as the iKnife or intelligent knife. This tool cuts through tissue, burning a small amount of it as it does so. This produces some smoke, which is then sent to a mass spectrometer to produce a unique chemical fingerprint of that tissue in near real time. This fingerprint can then be used in models to predict whether or not that tissue is cancerous or healthy. And considering these models have been performing with quite a high level of accuracy, you may be wondering why they haven't been used in the clinic yet today. This comes back to the main limitation of these models and the tool, its lack of interpretability, as doctors don't know why these signals are related to cancer and why others are related to healthy tissue. This is very similar to that radio example I was describing earlier. But luckily for us, we don't have to interpret the raw radio signal. We can look at the lyrics that come out of the speaker due to the decoder that's located in the cars that we own. This decoder looks at the intricate details of these radio signals and helps us produce the lyrics that we understand, such as, if you like it, then you should have put a ring on it. Therefore, you know immediately that that song is a Beyonce song and not an Eminem song. This is very similar to my research, where I'm hoping to improve the interpretability of these mass spectrometry fingerprints produced by the iKnife. By looking at the intricate peaks and valleys of these signals, we can match them to known biological molecules that are present in the literature in an automated fashion and use them in models to improve predictions. These molecules can then be tied to biological concepts that can help doctors actually understand what they mean. For example, certain molecules could be related to the increased rate of cell growth, which is known to be tied to cancer. By improving the interpretability of these models, we can allow doctors to actually trust them and use them in their day-to-day operations, ensuring that when a surgeon completes a procedure, they know they've removed the entirety of the tumor, and patients can rest easy knowing their disease is gone. Thank you.